Taking care of your teeth is not only vital for a healthy smile, but also for a healthy body. We're going to learn a lot more with a visit here to the GLEAM Smile Center at 678 Upper James Street in Hamilton. Joining me now is the registered dental hygienist, Julie DiNardo. Welcome to the show.
Thank you, Hal.
You're welcome. Julie, let's talk about the health of your mouth and how it has a big impact on the health of the rest of your body.
The health of the mouth affects the body because in the mouth there's a lot of bacteria. And if the gum tissue is red and inflamed, or if there's bleeding that's happening, the bacteria that's harbored within the mouth enters into the bloodstream. And when the bacteria enter into the bloodstream, it goes through the liver, and that's where there's certain inflammatory proteins are let off. They're called C-reactive proteins, and that's where it starts to damage either the heart, the arteries in the heart, or chronic inflammation such as rheumatoid arthritis and other diseases.
Now, when I came in before to actually have my teeth cleaned, you were feeling my neck for lumps and bumps. Why did you do that?
That's part of an oral cancer screening. What we're looking for is anything abnormal. So we're checking the lymphatic nodes, and we're checking the different glands within the head and neck.
Julie, we're now at the operatory. What actually happens in this room?
This is where the magic happens, Hal. This is where we get you healthy.
Nice, I like that.
Yeah.
You can also tell if I have good versus bad bacteria. How can you really tell if I do?
We have a microscope. Actually, we take a bacterial plaque analysis. We take a little sample of your plaque, and we take a look at it underneath the microscope, and we take a look and see what kind of bacteria you have, and that guides me to how to treat you properly. What kind of products that I should be using, what kind of chemotherapeutics I should be using, whether I should be using laser versus other things. So we have lots of equipment to be working with.
So when you're looking at my bacteria under the microscope and you see lots of white blood cell counts, is that a bad thing?
A few white blood cells are fine, but when there's a lot of white blood cells, usually that means that there's some infection that's going on that your body's trying to fight off.
Is tooth decay hereditary, or is it more to do with my diet?
That's kind of a two-part question. The tooth decay in itself is not hereditary, but more so the type of bacteria that somebody harbors in their mouth. For example, if we have a mom or a dad that has a lot of tooth decay, that bacteria that causes the decay can then pass on to their children. So parents who have a higher rate of decay, you see the children usually have a little bit higher rate of decay as well. So the hereditary factor really has more to do with the bacteria that's within kind of the family, right? So that's why I like to treat, if I treat one person in the family, I like to treat all of them. And as far as the foods that you eat, it's more so either the sugar content that feeds the bacteria that causes breakdown, or the pH level. So if it's very acidic, one thing we see with a lot of kids when they go off to high school or go off to university or college and they get into those energy drinks or like Gatorade sports drinks, they're very high in acid. So we see the enamel breaks down and we see more decay that way.
I have to let my daughter know because she loves those energy drinks. So she's cramming for exams. I mean, it really comes in handy, right? Now, how about teeth cleaning? How often should I come in and see you?
That's very individualized, Hal. I mean, one person can come in every 3 months, some people come in every 4 months, 5 months, 6 months, some people
I come in here every year?
or every year, and it all depends on what the situation is like, what the gum tissue is like, how healthy it is.
Maybe if somebody's a smoker, drinks lots of coffee too, that has an impact?
It absolutely has an impact.
Or drinks lots of wine. Some people like the red wine. That might have a bit of an impact.
It's a little bit more on the acid side, but you'd have to be drinking a lot of wine. And that's not a bad thing.
Think if on a toothbrush, I'm going to use this one right here. How's that? Sonic Care 3000 Turbo. How's it?
Listen, I know you're probably a kid at heart, but this is for a child.
Oh, this is oh, I'm sorry. Okay, let's put that back. Can I grab one of these then?
You can. That one's an Oral B.
Oral B. Oh, there you go. The power. Feel the power. Now, there's a proper way and an improper way of brushing your teeth, right?
That's right. Now, a lot of people ask me which is the best toothbrush or what should I use?
Right.
And it's very individualized. So for an Oral B, I find the people who work best for this are the type of people who are very precise or who like to spend a lot of time on their teeth, because it has to, rather than saying brushing your teeth, it's more like brushing your tooth. So you have to go tooth by tooth and, you know, six parts on a tooth and rotate it on each individual tooth.
Well, can you do that with a manual toothbrush as well?
Well, the manual is more. Well, the manual toothbrush is more so brushing about 2 teeth at a time.
Okay.
And working around the gums, right?
Because when I was a kid, I was taught to go round and round and round, but you don't do that as an adult. Why is that?
No, because the teeth, the shape of the teeth for baby teeth, they look like balls. So doing a round circular motion is great, but adults, they're more tapered at the gum line, so you want to actually get the toothbrush in about a 45-degree angle, give it a tiny jiggle, and then sweep it up, right? So you want to start at the gum line and then sweep it up, at the gum line and sweep it up. So in that way the bristles go underneath the gums and disturb all the bacteria and the plaque from underneath the gums.
Now Julie, this one's a little bit different. The Philips Sonicare has a bit of a different head to it. Is this something that everybody can use?
Absolutely. I really do like this toothbrush because it's a little bit more forgiving when you're using it. When we're looking at the Oral-B, it's more of a tooth specific. This one here, you just have to hold it in the general area and it does the work for you because it works on sonic wave. So for when we're looking at our more mature patients, for people who are having a little bit more problems with their manual dexterity.
Or arthritis maybe?
Or arthritis, yeah, and even able to maneuver the toothbrush, this toothbrush is much better for them because it does clean very, very well without having to be too conscious of what they were doing inside.
Now I know a lot of people that don't like flossing. You know, it's like whatever you do, they just can't stand flossing. So instead of floss, what you can do, I guess, maybe use something like a water pick.
A water pick, yes, that's a good alternative. We know everybody doesn't floss, and some people just won't floss. So we do have alternatives for flossing. If somebody's refusing to do it, well then we need to find something else.
We have to be very aware of the types of toothpaste that we're giving children, especially under the age of 12. Why is that?
We have to be careful the amount of toothpaste that we give the children. So children under the age of 2, we have to make sure that the size of paste that goes on their toothbrush is the size of a grain of rice. Or for certain people, there is a chemical within toothpaste or some toothpaste that's called sodium lauryl sulfate, and that really has an effect on the tissues within the mouth. So for people suffering from lichen planus or Crohn's disease, we want to make sure that that chemical isn't found within that toothpaste.
Julie, thank you so much for the education here at the GLEAM Smile Center. It was wonderful having you on the show.
Thank you for dropping by.
The GLEAM Smile Center, 678 Upper James Street in Hamilton. Give them a call or visit their website.